If I would have continued to practice medicine in that way, I would have just quit. I couldn't spend as much time with my patients. 15 minutes isn't enough. A barrier to an MRI and an X-ray is ridiculous. And so I had to be honest with myself. I wanted something that was my own and something that, I can kind of set the tone for. But I think that people, once they've had a couple of interactions with the medical system, they figure out that this model actually pays for itself. Think about what people have said about you, about your patients, right? Why do they like you? Because I do think that personality does play a role. You're the doctor, you are the assistant, you're doing everything, right? And so the hours are still long initially. My expectation was that it might be a little easier, but no, I'm still taking work home, but it's more gratifying. So I will say like a busy day for me would be 5 patients.
5 patients. Wow. So you are a board-certified family medicine physician.
Correct.
With over 15 years of experience in health and wellness, right?
Yes, absolutely.
But you went to the medical school of osteopathic medicine.
Correct.
So talk to us about exactly what that is.
The difference. So you have 2 types of medicine in the United States. You have ND, which is allopathic medicine, or DO, which is Doctor of Osteopathic Medicine. We take the same boards. The major difference is that in osteopathic medical school, we get about 3,000 hours of osteopathic manipulation, which is just learning a lot about the musculoskeletal system, and then learning how to manipulate that with our hands. So you can say it's a little bit more holistic, but we still definitely follow the allopathic principles. And so we take the same boards. We are family medicine doctors, we're dermatologists, we're orthopedics, surgeons. It's just 2 different paths to take to get into the medical field or to become a physician in the United States. Those are the only 2 types of physicians in the U.S.
Got it. And I know that your father's illness really piqued your interest to go down the medical route, right?
Yeah.
Why osteopathic medicine versus just conventional medicine?
Well, for me, okay, so it says you mentioned my dad. So when I was in college, I always wanted to be a doctor. I'll say that. I always was interested in medicine, but I never thought that I would be able to do it because I just had a little bit of imposter syndrome. I think that's very common. But I started to notice when I was in college, I was a health promotions major, did a lot of research and started to notice that the issues that were plaguing my dad were the same thing that were plaguing everyone else in my community. And a lot of it was rooted in lifestyle. Right. And so I started to realize that if we focused on changing our lifestyle, that is what would help us become healthier. And I think that the osteopathic philosophy looks at more than just, the disease. We look at the disease process, we look at the medications that help with the disease process, but we also look at the whole person, right? We look at their community, we look at their support spiritually. We take into aspect the whole person when treating them. So it's not always just medications. We're looking at other things that we can change or help them change to live a healthier lifestyle. So that's why I chose osteopathic medicine versus allopathic medicine.
Gotcha. And I know that you did your residency at a major hospital in Houston. Are you from Houston?
I am not from Houston. I'm from Dallas. I'm a Dallas girl.
Okay.
But I fell in love. And so I came to Houston for college. And so I came to Houston for college and then ended up going to Jersey for medical school because that's where I got in, but then was able to make my way back to Houston for residency. So that was great. It ended up working out that way.
Got it. And so how much of the osteopathic philosophy were you able to integrate at the hospital in Houston?
I didn't mean to laugh. I'll just say it's just a mindset because in reality, right, because of the current healthcare system, we have insurance that kind of dictates what we can do. And there are not a lot of codes that you can bill for. Like you can't bill for talking to a person about their, spiritual beliefs, or even it's really difficult to bill for osteopathic manipulation. And it's hard to do that stuff in 15 minutes.
Right.
So I didn't get to integrate it much, but I am lucky that my residency program had a faculty member that did osteopathic medicine. And so we had an osteopathic clinic. So once a week, we could still do manipulation in our clinic. But I think it's easier for physicians to practice osteopathic medicine if they have their own private practice, because it's really difficult to bill for it in the insurance world.
Got it.
So I didn't get to do as much as I wanted to, but I still do it sometimes.
Got it. And so through that experience, so I know that just with working with physicians who are transitioning, a lot of them have years of experience working in conventional medicine or with a group or in their independent practice. It seems like you went from residency to launching your own practice. Was that kind of the course? And what was your mindset during residency to say, listen, I'm meant to be an entrepreneur?
Yeah. So I think I've always been an entrepreneur.
Okay.
I was that girl that was like buying candy from Walmart for 30 cents and then selling it for $1.
Got it.
You know, I've always been an entrepreneur and I've always been very creative.
Okay.
And so I felt like in medicine and even in residency, because a lot of our residency, we're learning, but again, we're still dictated by insurance. And so we do everything like in a certain box. And I felt that pressure in residency. I couldn't spend as much time with my patients. 15 minutes isn't enough. And I didn't feel like I was training, but I felt like I could be a much better doctor. I had a following. They hired me on even after residency at my residency clinic because patients were following me because I really wanted to spend time with my patients to get to the root of their issue. But I could not practice medicine like that.
Mm-hmm.
So that is the reason why. If I would have continued to practice medicine in that way, I would have just quit.
Right.
Because that's not the type of doctor that I want to be. I do not want to just spend 15 minutes with my patient and move on and rush them and not be able to address their concerns. I would have quit. And so I had no other choice.
Yeah, that's a very powerful statement to say, like, if I can't practice the way that I know is what needs to be done, then I will leave medicine altogether.
Altogether. Student loans and all.
Yeah, that is so powerful. And so you said that you already had a following, or you had a following, that patients were following you, but you were still seeing them in that kind of confined 15-minute space. So what were you delivering in such a short amount of time that really inspired them to continue to follow you, even though, time was restricted?
I think that they see me as someone, I mean, obviously I'm their doctor, but I feel like I connect with my patients more. I think that there's something about being a Black woman physician and really understanding, like sometimes not feeling heard. And so I make it an effort to hear my patients and to kind of meet them where they are, right? I don't talk to them like I'm their, authority figure. No, I talk to them like a friend or somebody who really wants to help them. It's not just, going to see your doctor. I feel like they really were able to see me and they connected with me. So, yeah, that's what I can say.
Yeah.
I think that's what made it a little bit different, is that they felt like they can relate with me a little bit.
Yeah, you allow them to feel seen and heard.
Yeah.
Right. So you recently launched Lilly Primary Care with the vision of offering a safe haven amidst the complexities of the healthcare system. So what complexities did you want to remove from patient care? And I know we talked about it, but why did it matter to you so much? Like, you could have easily continued down the conventional medicine. And I know that you said, if I had to do it this way, I'm going to leave. I had no other choice. But why else did it matter to you?
There's so many complexities.
Yeah.
I can't even, there's just so many.
What's like,
I could give an
3?
example. Okay, so top 3, like not knowing how that you could easily just, instead of waiting months for an MRI or waiting for your insurance to pay for your MRI and saying, they're not going to cover it. And then when they finally do cover it, you're paying $500. It would be great to really, if you had a doctor that knew that an MRI is actually only $400. And so if you can pay the $500, just pay the $400 cash without using your insurance. So someone who kind of knows how to navigate that system and help you so that you're not wasting time.
Right.
Right? Same thing with specialists. We have connections with our specialist friends, our specialist colleagues that I could text them and ask them, hey, what do you think about this? What should the next step be? Can you help me get them in? So things like that. I'm trying to remove those barriers. Obviously, there are some things that are just difficult, right? If you need surgery, you need surgery. But a barrier to an MRI and an X-ray is ridiculous. I have patients that are using their insurance and paying $150 for an X-ray. An X-ray is only $30 to $50. So why are you now being billed by your insurance and they're acting like they saved the world by saying, oh, you only have to pay $150. It really cost $500. That's a lie. Wow, X-ray is not $500.
Okay. So where are they getting the numbers from?
I think I honestly,
Making them up.
highway robbery. I do not know.
Okay.
I think what happens is the imaging center think they know they're going to get reimbursed from the insurance, and sometimes insurance takes a long time to reimburse, and sometimes they only reimburse a very small amount. So they increase the price so that insurance can pay a certain percentage, but they're going to at least get that percent.
Got it.
Right, but it hurts the patients because they're caught in between.
Yeah.
And so some of that stuff is unnecessary. So that's what I mean by removing those complexities, and not to mention like prior authorizations, having to sit on the phone and try to get things approved. Just, yeah.
Yeah, and it's so interesting to have this conversation because we don't have the transparency around what the actual cost of these elements are in the healthcare system, right? Because, just as a patient, we're going into either a doctor's office or emergency room, and we go based on the recommendations of the physician. And it's just part of a system, like the way that it goes. Most people, or not most people, but people are used to paying for insurance through their employer or what have you, or aid, and going to seek care and getting it covered, right? No one's really used to paying out of pocket. So I'm really interested to kind of get into like what type of patient really understands the value of paying out of pocket versus going through a system that they've been doing for years.
Yeah.
So why not join an established DPC group? Why start your own?
I thought about it. I thought about it when I was in my third year. I reached out because DPC is very friendly. Everyone is trying to help each other. We're a small community, but everyone is trying to help. So I reached out to a DPC clinic close to me, and I interviewed and had discussions with one of the doctors there. And she was just honest with me. She said, if you want to come on and learn about it, that's great. We'll bring you on. But, if you also want to start your own thing, if you feel like you're the type of person that wants to start your own thing, you could do that as well. And I don't like being told what to do. I'm not a very good employee.
Okay.
And so I had to be honest with myself. And I wanted something that was my own, and something that, I can kind of set the tone for, make my own rules. And that's the reason why. I mean, it didn't really make sense for me to become an employee when I could just do my own thing. That's what I wanted to do in the first place.
Yeah. And so I guess joining a group would be interesting just to kind of really learn the ropes.
Yeah.
Right? So how has the learning curve been? Just kind of establishing your own thing. Where are you getting all of your education?
Yeah. So like I said, the community is very close-knit. We have Facebook groups where we share information with each other. We have something called the DPC, Direct Primary Care Alliance. And it's an organization for direct primary care doctors, medical students, residents that are interested. And so we share information like how to start the business, the tax information, where to order your supplies, the rules to follow, regulations. So we're it's really a grassroots movement. Yeah. And there's so much information out there. If you're able to get into the direct primary care group, the Direct Primary Care Alliance, and also we have conferences. So the Direct Primary Care Summit is one big conference of DPC doctors that comes together every year. The Hint Summit is another conference. And so we're meeting all the time. There's a lot of resources. So if this is something that you want to do, I'm not going to say it's easy, but the resources are out there. And so it's accessible and it's doable.
Are there any like additional licenses or certifications that you would need to transition, or is it just?
No, there's not.
There's not. You can literally open up your own DPC.
You
practice.
can, yeah, because I mean, your license is what you use to practice medicine, right? You are I'm board certified. That's another license on top of the 3 medical board exams that we take. After you take those 3 board exams, then you take your board certification. Not every doctor is board certified. What else do you need?
Right. No, I love this question, because a lot of times you just feel like, okay, what else do I need to obtain, or what other, tests do I need to get, or licensure?
There's no other test, but I will say you need malpractice insurance, which is expensive. Some of us, I think every woman should have disability insurance. But you need malpractice insurance, disability insurance, life insurance. What else? Business insurance. Those are big things that you're gonna have to come out of pocket for. A lot of times your employer will pay for those things, but this is now you're the employer, so you have to pay for that stuff. Then, there's startup costs for starting a practice. You have to rent the space. You have to, or some people purchase a building. And then you have to, get the supplies, get an exam table. It's a lot easier because if you compare practicing medicine the way we're practicing it versus like trying to build your own thing, it's actually easier to build your own thing
Wow.
versus like this circus, in my opinion.
Wow. Okay. That's really bold to say. Like, it's actually easier to go out and start your own.
For me,
For you. Got it. Okay. Got it.
for me, I would rather do this than participate in whatever they're calling healthcare over there.
Got it.
Yeah.
I love that. So take me through, because I like some of the exciting aspects of just launching your own business.
Mhm.
So take me through like looking for a space. Like, how did you know this was the one? And, like take me through that process.
Yeah, I got on Google.
Okay.
And thankfully, I think we were just coming out of the pandemic. I launched in 2024. I launched this year,
Okay.
but it was in June. And I think that a lot of the corporate spaces were still looking to fill, right? Because everyone was kind of working from home, working remotely, and a lot of these real estate buildings were empty. And so I think the prices were still reasonable whenever I found a building. So I just looked on Google, and then I found a building that was close to me, right across from Texas Children. So and it has lots of medical practices in there, and also 2 direct primary care practices were already in the building as well. A dental office, allergy office, therapy. So it's like a medical building.
Yeah.
And I just found a room in there that was a small space. The biggest thing with direct primary care is you want to keep your overhead down,
Okay.
because it's a new concept. People, again, like you said, they're used to paying out of pocket. I mean, they're used to paying with insurance. And so there's going to be some time where you don't have any patients, right? And you want to keep your overhead low. And it's easier to keep your overhead low when you don't have insurance.
Got it.
When you don't take insurance. But anyway, so I found the building by looking on Google around me, somewhere that was, close to where I lived, and just found a space that was affordable. And, it's actually, they don't even do a credit check. It's actually very easy.
It was easy.
I think for commercial real estate, I don't know why they don't even check. I'm sure for some people they do, but this particular company, they didn't check. So,
and you were able to. Wow. Okay.
Yeah.
I love that. So let's focus more on the actual membership model. So Lily Primary Care offers a membership model focused on personalized in-office and in-home care. So telemedicine is
in-home as in telemedicine.
Got it. So for those who are not familiar, describe what a membership model looks like in patient care.
So direct primary care membership model, there are 2 types. You have concierge medicine, which also is a membership model.
Okay.
They accept insurance, but then they also charge you a fee on top. Okay, and then you get unlimited access to them that way, but it's a little bit more expensive. So
Is concierge in office and at home? Or
I'm not sure. I think it just depends on the practice. It depends on the practice. But for me, my patients pay a monthly membership fee and they get unlimited access to me. And so what that means is they're able to come in and see me, have unlimited doctor's visits as much as they need to. They get discounts on labs and imaging, kind of like what we discussed before. And so I'll give you an example. So I had a patient who was having issues with sleep. I know her very well. She's already established care in my clinic. You don't have to come in for that. I can talk to you over the phone and give you recommendations. We don't have to do this whole hoopla, song and dance. We can make it very simple, give you the recommendations, and you move on with your life, and you get to, So it works for people who are very busy. It works for folks who have lots of chronic illnesses and who understand like how difficult it is juggling all these different office visits. You don't need to be doing all of that. So it just makes it more simple for my patients. That's what the membership looks like. It looks like a personal relationship with your doctor. You can text her and say, hey, this is going on. What do I do?
Yeah, I was watching a TED Talk on another physician who transitioned into DPC, and he was talking about like the whole notion around telemedicine in general. So I know that, through COVID, we got more comfortable with telemedicine, right? And understanding the concept. But a lot of physicians we don't realize that physicians are asking you to come into the office because they can't bill you over the phone, or they can't bill you through telemedicine if they're not set up like that. They're asking you to come in for things like, oh, just having trouble sleeping, and coming in, actually book an appointment, maybe like 2 months down the line, because that's the only way that they know how to bill. So that's how they're basically, they're set up to go, they're set up to follow the terms around insurance. So however insurance allows them to bill is how they have to treat.
Correct.
So it's not about necessarily the betterment of the patient.
Correct.
Or respecting their time or the efficiency. It's nothing like that. It's whatever they need to do to be able to bill this is how they structure it.
That is correct.
Payments. Okay. Got it.
That is correct.
So speaking of like just the membership model and, you know, the cash pay, I was watching one of your TikTok videos. So if you guys are not following her on TikTok, I'm going to link it below. So you had one TikTok that was like, you know, when a patient figures out that you don't take insurance and then they like hang up. So talk to me about what type of patient understands the value of paying out of pocket, and what type of patient education or awareness do we need to really create in order to understand that DPC may be a better way of care?
Yeah. So I think that it's hard to say the type. I think everyone eventually might understand the value, but initially it's those that are, you know, sick and tired of going to the doctor all the time and getting those out of pocket, getting those bills after they see the physician. Those that are really health conscious, and even some people that really have like a lot of anxiety surrounding their health and want to be able to reach out to their doctor. People that are really busy, moms, that might have like 2 kids and, you know, they don't have time to go to the doctor all of the time. It's easier, even like myself, I have my own direct primary care doctor. It's easy for me to just go ahead and text her and say, hey, this is going on. Can you put some orders in? I'll go to the lab. Let's figure this out. Folks that are very busy. But I think that people, once they've had a couple of interactions with the medical system, they figure out that this model actually pays for itself. And I'll give an example of a patient that had back pain on a Sunday. He was having acute back pain. He wanted to go to the ER. Unnecessary. Unless you're having a couple of red alarm flags, which he didn't have. I talked to him over the phone, sent him to the x-ray the next day for about $50, got an x-ray the next day, figured out what was going on. But we were able to save him an ED visit, and who knows what his bill would have been. It could have been $1,000. If you add up the monthly membership for a year, it's about $1,500. Right. And so it only takes a couple of avoided hospital visits or ED visits, even urgent care visits to pay for the membership.
Right.
So it just depends on, you know, where you are health-wise and how much you've interacted and how much you've been screwed by the healthcare system.
And so what about the patients who don't necessarily go to the doctor all the time, when they just kind of go for like their annual visits and things like that?
Yeah.
What do you recommend? It's still, does the model still fit for them? Like, you know, paying an annual fee, even if they may only go to the doctor once a year?
The model, in my opinion, the model fits because you never know when you're going to need to go to the doctor. You never know when you're going to need to be able to text someone quickly. So just to have that sense of security, to know, I know who my doctor is. My doctor knows me by name. She knows my medical conditions. If something were to happen and I got admitted to the hospital, my doctor can talk to the admitting team and, you know, help coordinate care with them. For that sense of security, I think it makes sense. But again, it's not for everyone, right? But it makes sense for those who understand.
It sounds really similar to concierge medicine. So what's the difference?
So the difference between direct primary care medicine and concierge medicine is concierge, they still accept insurance.
Okay.
So they still have a billing department that is fighting with insurance companies, and their overhead is super high because of that. And then they charge a fee on top.
Okay.
So those are our rich brothers and sisters.
All right.
We don't deal with insurance at all. So we'll just accept the fee, and then that's it. It's literally just the fee. And maybe if you're ordering labs, you'll pay for them at cost, like the self-pay rate, or we negotiate our rates with the lab company. So whatever rate we pay, we pass that on to the patient.
Got it.
So
So, one thing that really stood out to me when I was doing the research was some of the DPC practices actually had in-house prescriptions. And just coming from the pharmaceutical industry, I thought that was really interesting. But you actually have it at a wholesale price. So whatever they're probably paying, even with their insurance at the pharmacy, they could probably get it for a more affordable cost in DPC because you guys are purchasing wholesale.
Yeah.
That is
the thing. Yes, that is accurate, but not in Texas.
okay?
We're not allowed to do that in Texas. So I don't have that. We're allowed to carry like 3 days worth of prescriptions, but not more than that. But in other states like Oklahoma, yeah, these doctors are purchasing, like, say, for instance, amlodipine, which is a blood pressure medication, 1 pill for a cent. And so you get a 30-day supply and you're able to pass it on to your patient without even having to deal with insurance at all.
Wow, that's amazing.
Yeah.
I'm learning so much.
Yeah.
All right. So, DPC providers typically find patients through like outreach, online marketing, referrals, partnerships, basically however you find a patient, right? So, and I know that you're really, active on TikTok and things like that. So talk to us about some of your best patient acquisition strategies.
So I would say this is like the tea.
Okay.
This is the tea. I think a lot of doctors who are wanting to get into direct primary care really need to get on TikTok.
Oh, okay.
And just be their authentic self.
Wow. Okay.
People are struggling out there. Practices they're closing because they have less than 20 patients for the whole year, and they haven't been able to like figure out how to get patients. And I rely heavily on TikTok. That's where most of my inquiries come from. And then like my patients who have had a good experience, then they refer me to, their friends and family, Google reviews, but most of my patients have come from TikTok.
Okay, so let's talk about that. And that's how I found her, by the way, like I said. So so let's talk about, your authenticity around TikTok and like the mindset that you really had going in, trying it out. I know that there's a lot of rhetoric around, just getting on social media, but where did your confidence come from to really just start doing that, being your
I think I changed my mindset. At first, when you use social media, it's for fun, it's for family and friends, and people are very self-conscious about that. But when it's about business and you're trying to now match people with a need and a service, then you take yourself out of the equation. It's not really about you. You can show up as your authentic self is great. It helps with marketing, but you also realize you're less nervous because you realize it's not about you. You're trying to get a message to the people.
Right.
So where are the nerves in that? Like, you're looking at the bigger picture. What was the other part of the question?
Well, where did the confidence go?
Yeah.
And I agree with you. It's kind of like when you stop making it about yourself.
Yeah.
And like, what is the message I'm trying to deliver? And then also you're trying to operate a business at this point. So it's like, okay, what message needs to be heard in order for us to really truly deliver the value so that we can start to attract the patients that we are looking for, the clients that we're looking for. And just, I work with a lot of physicians that are not comfortable with the concept of social media. And even in my own practice, I do a lot of outreach just because that's more effective for me. But then there's also different type of personalities that may, do well with content as well. So what does the content strategy look like for you? Are you just really opening your camera and just talking about what goes on in your practice? Is there like a plan?
Yeah, it's kind of like figure it out as you go, to be honest. I have a friend, my best friend, who works in like social media, and so we kind of like play with ideas, and she sends me content or content ideas, but really I've just, if anyone asks me a question, I try to answer that on social media, like reply with things that are interesting or things that people have questions about, and try to solve problems. So my content strategy is really just education and trying to focus on solutions to problems. Those are the two main things. It's not really about like myself at all.
And a lot of I've looked for a lot of different physicians that really stood out to me, but a lot of them have like no medical advice like in their bio. So how do you filter between like the problems that you can address on a public platform versus something that you would probably address in your office?
So I keep my topics very general, nothing like specific. If I get DMs, I just don't answer them. I actually used to have that in my bio as well, but there's just not enough space for that. I think it's obvious that I'm not gonna give you personal medical advice, but I keep things very general. Like I'll talk about health topics, just general things that people should be doing, not really talking about specific. I might talk about how a medication works, but I'm not going to say this is what you should do or get on this medication. I might give you an example of how the medication works and just keep it very educational.
Got it. And I know that, like the GLP-1s are really popular right now. Are you seeing a lot of patients for that? I know it's just like a popular topic, and I'm wondering, like, how does DPC handle that?
So yeah, I do see a lot of patients. A lot of people are very, very interested in that. Obviously, it's weight loss. The DPC model works well with it because there are some ways to get the medication. So compounded pharmacies are another way that you can get the medication for cheap and pass that savings on to your patient. So we handle weight loss the same way that we handle blood pressure or diabetes. We see obesity as a condition, right? And so it fits in the scope of primary care, lifestyle medicine, obesity medicine.
And how many patients do you typically see on a day?
So I will say like a busy day for me would be 5 patients.
5 patients. Wow. Are you serious?
Well, the thing is, it's an hour visit.
That is no.
That hour,
An hour is long. Oh no.
you should have lunch.
No, I understand, right? Listen.
You have to have lunch.
Wow.
You have to have
Five?
lunch,
Wow.
Okay.
Yeah.
and you have to do consultations in between. It's a lot. I mean, I'm actually drained after
Yeah.
that. But coming from like,
Traditional medicine where I'm seeing 22 patients a day, I think it feels a lot better and I feel a lot better about the work that I'm doing.
Got it. Okay. What do you think about the United Healthcare CEO?
Yeah. I think that there's a lot of anger in this country, not just from patients, but from doctors. And, in the doctors chat, the commentary was worse.
Yeah.
It was terrible. Yeah. Okay.
Yeah.
So I think there's a lot of anger, and rightfully so, because United Healthcare is the healthcare company, the insurance company that is responsible for Medicare, Medicaid. They're responsible for the healthcare insurance of about 24% of the United States. That's an issue if you are the one denying the most claims out of all of the insurance companies. So there's going to be anger.
Yeah.
There's going to be anger. And I think that if you don't want your life to be ran by insurance companies, consider enrolling into a direct primary care practice.
Got it.
You can go online to the direct primary care mapper, Frontier Mapper, and you can find a DPC practice near you. And then maybe pair your direct primary care membership with a catastrophic insurance plan.
Right.
Or use your HSA or FSA if you can to pay for your DPC membership. So that way you actually get health care and not just insurance.
Makes sense. Yeah. So when we set out to launch new things, like we have all of this momentum and excitement and things of that nature, but what are some of the expectations that really didn't live up to your vision and really starting your own practice?
I can even go back to this week. I was like, I went into this so I could previously I was seeing 18 to 24 patients a day. And then I capped it off. I told my boss I can only do 20 patients a day, no more than that. And they filled me up, made sure I saw at least 20.
Yeah.
And I said, man, hopefully if I go into DPC, my life will be a little bit more balanced. No, I'm still leaving very late. There's still a lot of work to do because now you're the doctor. If you don't have a lot of help, you're the doctor, you are the assistant, you're doing everything. Right. And so the hours are still long initially. But then when you get more help, hopefully it becomes more balanced. So I think my expectation was that it might be a little easier, but no, I'm still taking work home, but it's more gratifying to do it this way versus the other way.
I know that you said that you were interested in kind of maybe hiring another physician or support. Is it only you in your practice right now? Oh, wow. Yeah, because I called the front desk. You got me. Hi, I'm Bianca. And I just emailed and you're like, hi, it's me.
Yeah, it's me. Everyone's always surprised. And I think that's actually a selling point, actually, because they're like, okay, I get to talk to the doctor directly. There's not a nurse in between. There's no need for that right now.
Yeah.
Maybe when I get to like a certain number of patients, there'll be a need, but not yet.
Got it.
Okay.
Makes sense.
Yeah.
What has been the most challenging part of your journey so far?
I think it's mental.
Mm.
I think it's like just kind of staying in the game and realizing that, you know, maybe lowering expectations a little bit and not getting too like down on myself. Um, I think that has been a little bit of a challenge. But, you know, there are good days and there are days where like a patient might say, you know, this membership is not working for me anymore. Right. And that always hurts your feelings because it's like, I did everything that I could, but they just can't, some people can't afford it.
Yeah. Yeah.
Right. And so that you can't take it personally,
Right.
but that's a challenge. And that's only happened a couple of times, but still, anytime someone leaves, it's like, you know, you feel sad. So
I know that's really interesting, and just like the business consulting part of me is coming in. Are- Is there a certain way that you have to structure your membership plan? Like, does it have to be monthly? Can it be annually? Because you got to then talk about churn rate and retention and making sure that you're giving them all of the value for their membership, even if they may not come into the office. And then you have obviously times where patients may not be able to afford it moving forward, and that can affect your bottom line.
Mhm.
So do you have control on the way that you structure the membership plans and
Yeah.
pricing and things like that?
you have complete control. It's up to you. There's no
So you
red
set your
tape.
own rate. You
Yeah.
you basically look at everything that you want to offer, all of your services. You create your services. You develop your packages, your pricing, your membership plans, and things like that.
Yeah, there's no you do it yourself. And so yeah, if I want to do a yearly, that's fine, you know, and I do that actually. But I think most practices should expect some churn.
Right. Right.
Like that's something to expect.
Right.
And that's just a part of it.
That's the part of the experience. Got it.
Yeah.
All right. So, being a business owner, like you said, it's kind of like, the mindset and the sticking with it, keeping your head in the game. But and it's just kind of like this grind every single day. But then you have these like sparkly moments where you're like, oh my God, like this is exactly why I do what I do. So do you have a story that you can share with us that just really kind of like really honed in on that specific moment, if you have one yet?
I mean, I think it's like an everyday thing. I can't think of anything like off the top of my head yet. But I think that TikTok and the education portion, I think that that's been a lot of fun, right? To open people's eyes to direct primary care. I think not that that's a good thing, but the United CEO issue and people really opening their eyes to what's been going on in the insurance system, that's been a big, like, okay, this is important. People need to know about this.
Definitely.
But I think every day in those day-to-day interactions, I think that I'm making a difference for my patients because they tell me.
Yeah.
And so I can't think of a particular story, but every day, like every time I save someone money, that's a big deal.
Yeah, for sure.
So,
So doctor, who are you like outside of being a physician?
oh, a lot.
Thought to it.
I'm a mom. I am a person who is very creative, who loves like aesthetically pleasing things, and I am a person who's very strong-willed, who doesn't like being told no, and I'm a person who likes to follow through on the things that I say I'm going to do, and I expect that from other people. Yeah, so I think there's a lot of, yeah, I'm creative, I'm an entrepreneur, I'm all of those things outside of medicine, but I think that practicing medicine in this way allows me to integrate everything. Because it's really, really hard to, medicine, it's easy to be in a box in medicine. And I think you have to kind of find a way to integrate it. So when I'm at the store, if I see a patient, I'm still Dr.
Right.
I'm still Dr. Addie or Adesola. But yeah, I'm all of those things.
For sure. And being able to do something that really connects with you, I was important your core. And you don't have this split authenticity, right? It's like I can do what I love and be who I am at the same time, which then creates a calling.
Wow.
And so do you feel like this is something that you're going to do long term?
Yes, absolutely.
Yeah.
Absolutely.
And you have certainty. Like
I do. I know that I'm not going back to. I 100% know I'm not going back to
To fee for service with insurance. That will never happen.
Got it.
I will move to another country. Right.
Okay. I love that.
So this is gonna be it. This is it.
I might expand. Maybe have other people working for me. But this is what I'm going to be doing.
I love that.
100%.
So what advice would you give to a physician that is looking to transition into direct primary care?
I would say think about what people have said about you, about your patients, right? Why do they like you? Because I do think that personality does play a role. People are wanting a membership and they want healthcare, but some people also they really care about the personality of their doctor.
Mm-hmm.
And then I would also say save money. Make sure that you have enough so that you can focus on your business. When I started out, I was still working 2 days a week at my residency clinic because they liked me.
I was going to ask you that.
On.
Does it make sense can you do this part-time, you think? What? You still work in traditional and conventional medicine while you're building out your DPC?
It's a little bit complicated, but yes, a lot of people do.
Okay.
They do that initially. There's this whole thing about Medicare opting in and opting out. If you work at an FQHC or a medical facility, you'll have to be a physician that takes Medicare or Medicaid. And if you do that, then you can't accept patient money from people who have Medicare or Medicaid. So in your private practice, you're not allowed to have any Medicare or Medicaid patients.
Got it.
So it's kind of understanding the nuances between that. But I would say if you can save enough money, that way you have a cushion before launching, then that way you can focus on your patients and then do marketing. Or if you can find someone who can do the marketing for you, that's great too.
Got it. Okay. And I know that sometimes if you're part of a group, there's a conflict of interest, certain things. So you got to look at your contracts and
also, if you feel like you're in residency and you feel like you're going to start a DPC sometime down the line, I made it a point not to sign a non-compete.
Okay.
I wouldn't sign a non-compete. People are desperate. They can hire you without you signing a non-compete.
Yeah.
So I never did that. And that is what allowed me to do. Because I think a lot of doctors do.
Right. So you definitely got to take a look at that. Okay. All right. So Dr. Adesola, where can we find you and how can we support you?
Yes. So you can find me on TikTok at Dr. Adedo. I'm also on Instagram at join.lily and then online at lilyprimarycare.com. If you want some maybe education and entertainment, I probably just follow me on TikTok.
Oh. Sounds good. Yes. All right. Well, thank you so much. This is definitely an empowering conversation. Yeah. I learned so much about direct primary care in general, just as a patient and also as a career and business consultant to physicians and health visionaries as well. And I didn't really, and you know what's so interesting is when we set out to do something new, we just feel like there's so many obstacles or there's so much resistance, and without that clarity, it's really hard to kind of vision where you can go on the other side of it. And so that actually keeps us small, and then we end up staying in this box that we don't necessarily have to be in. And congratulations to you for already, understanding what the vision was and then answering it, because a lot of, physicians and health visionaries they have a vision, but they're not taking action because they don't have the clarity. And so hopefully this conversation really brings the clarity to them so that they can see that this is possible and this can be done. Although navigating it could be challenging, there is support, and this is something that you can absolutely do. And so I hope that this inspires someone to really take the leap from career to calling. So thank you so much. I really appreciate it.
Thank you so much for having me. And I hope the same thing. I hope that if you haven't heard about direct primary care, that you do your research, look into it. And there are lots of beautiful coaches that are able to help you. So look them up. And I'm just happy to be here and spread the word about DPC.
Thank you so much. Pleasure. Yeah. All right. Thank you guys so much for joining me this week. My name is Bianca Ariel. I am the founder and chief visionary officer at Recalibrated Vision, where we are empowering physicians and health visionaries to transform their careers into callings. So make sure that you subscribe and you like and comment. Also, let me know what type of specialty physicians that you'd like me to interview. I would love to have them on. Also, the day we drop this episode, we're also dropping our premium resource. So it's going to be the #1 purpose-driven career development and transition resource for physicians. And so what we're doing is we're cultivating a lot of research, insights. Obviously, this month's topic is going to be direct primary care, but also the foundation of a career transition. So make sure you check out the link in the description below to check it out. Thank you so much. And remember to always and forever stay free.